how can we help to identify people that might need care before they know it? To be able to say, of all of your tens of thousands of employees, which ones do we want to reach out to say, hey, we're here for you?
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster, here with Stephen Sokoler, CEO and founder of Journey. Good to see you, Stephen.
Good to be here.
You are working in the mental health space. How long have you been in this market?
February will be 10 years.
10 years, okay. So I consider you sort of a pioneer in this market, digital health, for mental health. Let's go back. How did this company start?
So I was very fortunate. I found meditation while I was living in Australia like 15 years ago, actually even more than that, and it changed my life. And I was running a different business at the time, ended up selling it, had no idea what I wanted to do, but when I looked at the mental health landscape, I thought there was an opportunity to both help people and build a business. And so started the company as Journey Meditation Inc. Okay. We've subsequently dropped meditation from the name as we've added all the other subclinical and clinical stuff. But yeah, it was just mental health changed my life, and so I thought maybe there was an opportunity to bring it to more people.
Educate us on meditation. You said I discovered meditation, and then connect it to like clinical outcomes for us.
Yeah, well, for me, I found a book on meditation, or a book on meditation found me.
Okay.
And it was transformational for me. And there's like tons of data, tons of science out of Harvard and Stanford and Yale on the impact that meditation has on people's minds and bodies, and then tying that to outcomes. And when we work in the corporate world, again, now we've expanded to add the clinical component and all that stuff. But back when we were doing just meditation, we had a clinical study with a neuroscientist at NYU that showed some of the benefits. So yeah, it's great that it's now been so studied, so that people, there's people like me who I just picked up a book and I was like, oh, I'll give this a try. There's other people who are more like, I really want to understand what are the benefits.
Yeah.
And so we have all that data also.
Well, how would you describe meditation for beginners?
How would I describe meditation for beginners? In terms of what?
Let's say I am getting on your platform. Maybe I'm nervous about the idea of meditation. Maybe it feels a little woo-woo to me, and I don't even know that like kind of meditation 101 is maybe simple breathing exercises, or tell me kind of what meditation 101 is if you go into a business and you have somebody who is not familiar.
Yeah, I mean, I'm a little rusty on this, I'll have to be honest, because of the fact that we probably expanded outside of meditation pre-pandemic, and so most of the time now we're talking about mental health and the clinical aspects. That said, meditation is my daily practice, but if I was to answer your question, I mean, I think of meditation as exercise for your brain, exercise for your soul, right? The same way we all know that we should be moving our bodies, taking a nice leisurely walk around, doing some exercise, right? Whether it's meditation or journaling or breath work, the idea being we need to take care of what's going on up here. And meditation is many practices, right? It's not just one, to be able to do that, to open up your heart, to focus, to concentrate, to gain more clarity. So tons of different benefits.
What are the aspects of the Journey platform that you're most excited about in 2024?
Yeah, so in 2023, we said we are going to launch this new product that we had been developing for a few years called Journey Proactive EAP. Okay. So basically, every company has, or 99% of companies have an employee assistance program, and most of them are very outdated, right? They're traditional EAPs, they have low engagement, it takes forever to get care, and so we launched this product, and now for the last almost 2 years, we've had this product in market. So to 2024, the thing that I'm most excited about is some of the predictive analytics that we're doing, right? How can we help to identify people that might need care before they know it, right? So using AI, using machine learning to be able to say, of all of your tens of thousands of employees, which ones do we want to reach out to say, hey, we're here for you?
How do you do that?
There's a number of different ways. So for some, we look at things like their zip code. We look at, meaning knowing where they're located. We know whether dependents have gone up or down. If there's been a job change, so things like that. Also, depending on what permissions we get, obviously security is very, very important to a lot of, and rightfully so, to a lot of big companies. Being able to look at what people are writing, how they're writing, the pace, things like that, to be able to say, is this person triggered? How are they responding to things?
Both potentially invasive, also potentially life-saving.
Yeah, I mean, it's a tricky balance between the whole like Big Brother thing, right? Who's watching you, and then being able to really help people. We're talking to a company now about a partnership that, I don't know if it'll launch this year or next year, using wearables to be able to say, okay, based on that, we know that you're triggered, and maybe before you press send on that email or hit enter on Slack. Maybe now's the time to pause, to reflect. And so really integrating those products.
Pretty granular.
Yeah, exactly.
Okay, so that's pretty interesting. So I'm wearing a wearable, it's integrated. Obviously you're not doing this yet, but the idea is very interesting. That all of a sudden my heart rate's gone up. Other aspects of what I'm doing suggest that maybe I'm getting triggered, I'm anxious, I'm angry, and I might get in the moment like a suggested activity.
Yeah, to take a pause, to take a breath.
Breathe.
Yeah,
That's
simple,
fascinating.
simple, yeah.
Simple yet highly integrated into your daily life.
Yeah, exactly. And I think
Not
the thing that I think is interesting, now maybe I'm too deep, is that there's a lot of great point solutions out there. I mean, we're surrounded by them here, right? But with an EAP, every company has an EAP. And so it's one of those things that for a long time has been a check the box benefit. But now it's like, well, what if we could take this and reimagine it? What if we could turn this model on its head? So instead of being a thing that sits on the shelf and is only used in a reactive way, what if we could be proactive and really engage people? So there's daily emails.
Oh, are you trying to fix the whole EAP and not just add on a better mental health portion of the EAP?
Correct. Basically, we had a product called Journey Live that up until 2 years ago, I mean, we still have it, but it was complementing EAPs because EAPs they had low engagement, people weren't using them, they weren't very diverse or modern. And then we said, why are we complementing this outdated product that's not working? Why don't we just build a modern one that's going to work for today's workforce? And so we did that. So like, for example, a traditional EAP, it's 3% engagement. With Journey, it's 30%.
Wow.
With the traditional EAP, it's 3 weeks on average to get care. With Journey, it's 3 days.
Wow.
So how do we think about this model and say, do it much better in a way that employees want and their families want and their extended families want? So things like that.
Why didn't some other big incumbent come in and do that?
Well, they have actually. So the space basically has two different parts to it. So you have traditional EAPs, those are 50 cents or $1, and those have existed forever.
Right.
And then you have, right behind us, Spring Health, Lyra Health, great products, but very expensive. Instead of 50 cents or $1, they're $10 or $15 per employee per month. And so if you have the budget and you can upgrade to that, great.
It's a Cadillac service.
Yeah, we want to provide that level of value at a price that companies can afford. So we're coming in at $2 or $3 or $4 PEPM. So now companies are saying, hey, we want to provide great mental health support and we don't have to break the bank doing it. So it's really struck a chord with the market.
What's your secret for keeping it affordable?
So we have a different model than some of these other folks. So when they came into the space about 8-10 years ago, they had to go and hire a lot of full-time employees, full-time therapists, which makes sense, but it then becomes very cost prohibitive. We said, we're going to take a different approach. We looked at the whole market. We built a 3-tier network. So full-time Journey employees, a preferred provider network, so that's 5,000 therapists who give us preferred access to their calendars and we pay them slightly more money, and then a large global network. So that balance allows us to have the control and speed that we need while being able to deliver this at a price point that companies can afford.
Nice, okay. So what's next? What should we be looking forward to from you?
Well, after this, I'm going to take a red eye home to go be with my son, so that's next with me. Let's see, journey-wise, I think next year is going to be really interesting because I don't think I mentioned this actually here, but a lot of what we do is how do we deliver this to employees in a way that meets them where they are. So not just a website or a mobile app, but also a Slack app, a Teams app, a Zoom app. And we're building those out to be even more robust than they are now, so that no matter where you are, we have a break room app. A lot of our clients, like we work with Beck & Dickinson, which is manufacturing. We work with a lot of different types of clients, and the harder they are to engage, the better it is for us. Like that's where we really shine, is how do we find those employees who wouldn't naturally gravitate towards this and come up with a boutique approach. So being able to do that more and tell more of that story, I'm really excited about.
Awesome. Well, Stephen, thank you for taking a little walk with me and explaining what you're working on. Wish you the best in the next year.
Thank you. This was a lot of fun.
All right. Thanks a lot.